Good evening, parents. We are delighted to have you join us in this informative and interactive live session today, created to help you understand why baby skin becomes dry in winter and how you can keep your little one protected and comfortable throughout the season. As temperatures drop, the air becomes significantly low in moisture, and babies are especially sensitive to this change because their skin barrier is still developing. Their skin is thinner, loses moisture faster, and reacts quickly to cold winds, low humidity, and indoor heaters. This is why so many parents notice rough patches, peeling, redness, or irritation during winter. Simple everyday habits can also make dryness worse, such as long baths, very hot water, strong cleansers, skipping moisturization, or using products that are not suitable for a baby's natural pH. When all these factors combine, dryness can build up and sometimes turn into irritation or rashes. For this workshop, we are privileged to have Dr. Manish Balde. Dr. Manish A. Balde is a consultant pediatrician and neonatologist at Motherhood Hospital, Gurgaon. Having undergone his medical education and training from reputed colleges, Dr. Manish A. Balde is well versed in performing a variety of pediatric procedures. Dr. Balde is also a medical scholar and has many articles published in medical journals. In this live workshop, Dr. Manish Balde, with him you will learn about the following topics. Dr. Balde, welcome and thank you for joining us. Please share your thoughts on today's topic.
Thanks, Carolina. A very good evening to everyone. As we know that with a brief intro by the Carolina, is very thin and very fast dry during the winter season, and the maximum mother common query like my baby is getting chapping and peeling during the winter. How to take care of my baby's skin? And there are lots of advice from my neighborhood. What should we do? Actually, there is not any scientific insight. So here we are going to discuss one by one scientific aspect of the baby's skincare and how do we proceed further and how do we avoid the further damage of baby's growing skin. Yeah, Carol.
Thank you, Doctor. That was very insightful. Before we go any further, I would like to remind all parents joining us today that Dr. Balde will be answering your questions live during the session to help you make informed decisions about your child's skincare routine. Let us begin with the first question. Uh, Dr. Balde, my first question to you is why does baby skin get so dry in winter compared to the rest of the year?
Yeah, during the winter season, the outside is very cold and chilly, and inside the house, we are maintaining the temperature. During that temperature, humidity is definitely very low, and that low humidity may affect hydration of the baby's growing skin. Why? Because in a baby till the age of 6 months, the stratum corneum of the skin is not fully formed. So baby's skin get dehydrated, and that dehydration causes as well as dryness.
So, what changes happen in the winter environment that affect a baby's skin barrier?
So, as we know, the humidity dropped, and the inside hot environment and the habit to give bath with the warm water as well as the lack of digestion may affect the baby's skin. And as we know that the tiny skin is layer of the skin is not fully formed, which may cause problem and dryness.
Thank you, doctor. That information was really helpful for the parents watching this live. We have some more important questions for you, of course. But before we continue, I want to encourage all parents to share their questions in the
Yeah.
comments. We will try to take as many as possible during the session. Uh, Moving on to my next question, Dr. Balde, what exactly changes in our skin as winter sets in?
Carol?
Yes, Dr. Balde, can you hear me?
Yeah, yeah, please. Can you
Yeah, so
repeat
my
the
question was what
question?
exactly, yes, what exactly changes in our skin as soon as winter sets in?
So it's that much normal as the earlier month in the dry season as it started. Dry season, the skin moisture and hydration is not maintained. Second thing, as well as warm water, which may cause the outer layer skin damage, and that damage a problem. And in the babies, because of immaturity, that may cause prolonged uses of alkaline soap and the scanty produce that may cause eczema. So there are two type of problem during the winter use. Is normal environmental changes may cause skin eruption and changes, as well as and again skin hurt that cause eczematic changes or dermatosis.
Right. And why, and of course, you've spoken about a baby's skin barrier earlier, but also why does their skin get dry faster in winter compared to other seasons? And how does that affect a baby's skin barrier specifically?
So as soon as the baby is born, their skin pH is little alkaline, 6.4 to 7.5. And within a few weeks to month, because when the pH is around 5.5, it generate a acid mantle. Acid mantle give the base to lipid surface to make a oil film. Process of getting colonization of pathogenomic bacteria. So the pH 5.5 around that little acidic is giving the strength to the skin. Think the moisture which contains such pH, definitely it give outside from strength to the growing. And second thing, the lipid accumulation of oil film is very low in the baby who is under the 1 year of age. So this dryness and chappy during the winter season. And over that, if the parents give daily 1 or 2 warm bath, and after bath, regular that cause more problem to the damaged skin.
Speaking to your point, Dr. Balde, what is the right pH for a baby's skin?
Yeah, as I discussed, the pH 5.5 of studies, as per the studies that showing if pH is around 5.5, that give means you can say it make a acid barrier of the skin, which may reduce the chances of bacterial colonization, and it give film surface to growing a lipid it's oil rippling. Second thing, that slight acidic pH it was some corneum. So the damage of skin gradually reduce. So that's why it's during this pH 5.5, skin integrity will be and including winter also.
So pH 5.5 being the key word here, how does that How does pH 5.5 support a baby's skin barrier during winter?
Yeah. So a mild acidic pH around 5.6 optimize lipid processing system and enzymes, which may help to give for layer of skin, hard skin, that is called stratum corneum, and limit the growth of pathognomonic bacteria, thereby they helping the baby's skin integrity. First thing. Second thing, it will shape of skin. And third, it will give strength to skin from the again sensitivity from the outside during the winter season.
Okay. And what everyday habits do you think can make dryness worse without parents realizing it?
Yeah, the most common habit is a daily warm bath to the small baby. And some babies means some parents are having daily one or two warm bath, as well as they having rubbing the bath and lack of using of moisturizer, as well as using alkaline soap with the good and that may disrupt the growing stratum corneum, as well as that may cause colonization of bacteria. And if we repeatedly damage that skin, that will
Right, and now, I mean, we all know it's winter season. Everyone is using a heater indoors. It's getting really cold outside. So does using a heater indoors dry out the baby's skin even further?
So, being a pediatrician, usually I advise, yes, if the outside is very low, that may harm to baby. But if you really want to intend to use the heater, better to use single oil heater, which is 100% maintain the humidity. So, if your fall, you have to maintain skin integrity, because as soon as we use of the skin water, and that may cause dryness. So either we have to use a place, or we must use a good layer of moisturizer at least 2-3 times in a day.
Thank you, Dr. Balde. That's really helpful. Also, is there an ideal bath routine you would say for babies during the cold season?
So during cold season, gentle bath about 2 to 3 times per week with a lukewarm water, and the water temperature should be like 37 and you can use mild cleanser better to maintain the moisturization, because even though that water may further cause dryness. And after the bath, moisturizer as soon as possible. So that is the proper way to maintain the skin hydration winter and the bath.
You mentioned a gentle cleanser. Over here as well, I would like to ask, is a pH 5.5 cleanser something that's important? And also, should the frequency of the baths reduce in winter?
Yeah, parents should reduce bath frequency if skin is very dry or eczema prone, or if the family history of eczema. 2 or fewer daily localized use of cleansing is generally safe and provide generous emollients are applied. During the bath, better to use cleanser. Of course, the pH 5.5, as we know that mild growing skin, we should use that only.
All right, Dr. Balde, we are going to take a question from one of the parents who have tuned into this today. Um, Rita asks, my baby's cheeks look red and rough only in winter. Is this normal or a skin problem? Sorry, this is from Anjana. This is from Anjana. My baby's cheeks look
During
red and rough in winter. Is this normal or a skin problem?
so during the winter, if you find very chapped, red, and this seems little erythematous, it's not a very big problem. It's the problem because of surrounding is not that much healthy for your baby's growing skin. If it's scaly, definitely it's a problem which required medical attention. But if it is not scaly as well as not inflamed, not causing any problem to the kid, we can maintain safely with the use of moisturization of the skin at least twice or thrice a day.
All right. We're taking
Same,
another
the pH
question
5.5.
from. Okay. Thank you. We're taking another question from a parent.
Yes, yes.
Rita asks, if my baby cries during moisturization, what does it mean? Should I change the moisturizer?
Of course, as we discuss about the pH, that is definitely go with those moisturizer which contain pH 5.5 first. Second, why the pH 5.5? Because it will maintain the acid mantle of the growing skin. But moisturizer should contain the product which actually help to maintain the skin, and the contain the oatmeal's shea butter and petroleum product which give strength and to the growing skin to maintain the pH.
All right. Is it also important? I mean, of course, we spoke about cleansers and moisturizers. So just continuing on that subject, how important is it to use a gentle cleanser during winter? And is there a right way to moisturize post cleansing?
Yes. So, as per the advice, we should use cleansing gel during the bath, as well as not in a very warm water. The lukewarm water will be around 37-degree. And after a good bath with that cleansing, we should use moisturizer. Moisturizer should ideally be applied within a few minutes of the bath, while the skin is still slightly damp, and reduce subsequent transepidermal water losses. Because as soon as the babies get warm, initiate, and that may cause further dryness. So the parent is having like if we are doing the bath, the baby's skin is very good and healthy. But vice versa, if you are giving without any cleansing and moisturization during the winter, it may cause more roughness and skin.
And how soon after, let's say after bath, how often should parents be applying or reapplying moisturizer throughout the day?
So in winter and for very dry skin, emollients can be applied several times a day, at least roughly 3 to 4 times in a day, and especially to expose or trouble spots such as cheek and hands, like ankles and knee, where the maximum friction will be there with the cloth, with the plate. So at least 3-4 times in a day, we should apply moisturizer.
All right, I'm going to take another parent question, Dr. Balde. We have Kavita, who is a pregnant mom, and she asks, how soon after birth can I start bathing my baby in winter?
So, first, as soon as baby's first bath, first thing. Second thing, during the winter, we introduce the baby with the water. So, as we advise as a pediatrician, First, water contact. And during the winter, you can give the bath whether the baby is even though 2 weeks old with a minimum water contact. You must have to give a contact with your babies and just remove it. After the next day, you can increase the time. So the good bath may spend 4 minutes, not beyond that. And you can start baby bath after 2 weeks and there are no any medical problem.
Thank you, Dr. Balde. This is a reminder to all the parents to keep sending in their questions, and we will address as many as possible in this session. Dr. Balde, I'm throwing another parent question at you. This is from Anchal. Anchal asks, some days her baby's skin looks fine, other days it suddenly looks dry again. Is this normal in winter?
Yeah, it's normal. And sometimes the parents again and again visiting to pediatrician and dermatologist because of this. This is not a problem. As I told earlier, that is because of the surrounding and environmental changes, because the transepidermal water losses. So skin require hydration. So that dry skin, looking dry skin, that means your baby's skin asking for the hydration. First, to increase the water liquid intake of your baby and maintain that. And second thing, you have to maintain tropically with the moisturizer skin hydration. So basically, you have to reduce
Is that you mentioned the right moisturizer, so I'm just going to harp on that a little bit. Which ingredients are considered gentle and effective for dry infant skin?
So the basic moisturizer is like ceramides and glycerin, hyaluronic acid, petroleum oatmeal, and shea butter, which should be the fragrance-free and hypoallergenic formulation. Type of formulation should be alcohol free and the pH should be like 5.0. These are actually the ideal ingredients of the ideal moisturizer.
Are there any specific ingredients that you think parents should completely avoid during winter?
So parents should avoid product containing strong ice, alcohol, high alkaline soap as this can disrupt the skin pH and may precipitate eczema itself. So during the winter, even though if the alcohol wipes to wipe the baby, definitely they harm to the growing skin.
Right. Another parent question. Of course, we have Simran and Priya with slightly similar questions. Simran asks, "My baby is under 3 months. Is skin shedding at this age normal?" And Priya asks, "Is my baby's skin peeling or flaking because of winter, or is it just newborn skin?"
So first, for newborn babies, it's quite normal thing because in the mother's womb, the baby is containing vernix, and that vernix is the surrounded part which give babies, growing baby to inside the mother's womb. So as soon as baby delivers, that vernix caseosa gradually forms till the age of 2 or 3 weeks. But if your baby is 3 month old and skin shedding is there are two possibility. If it is specifically during the winter and the baby is to the cooled air, definitely it's a common. But if persistently skin shedding with systemic problems or associate symptoms, you should visit to your pediatrician first.
Okay. And is there a way for parents to differentiate between normal winter dryness and eczema?
Yeah. So normal winter dryness present as fine non-itchy scaling. Whereas eczema typically show dry, red, itchy, sometimes like in a field or ooze history of atopy. Second thing, if it is eczema, the child seems to be very irritated. If it is only weather-associated skin dryness, the child should be happy. The parent seems to be like little problematic. Why? Because the skin is not glowing that much and she seems rough.
There's we have another viewer question. We're going to take this from Webhub. Webhub says many families recommend daily oil massage in winter. I believe this is a very traditional Indian thing. Does this actually help with dryness, or can it sometimes worsen it? An oil massage daily.
Yeah. So it's very common and generic question. Each and every parents and dadi, nani always asking to us when should we start oil massage. So let me clear, during the winter, yes, massage maintain the hydration of the baby's growing skin. But we should know the basic precautions. If you are using oil massage, the oil is never ever hydrate the growing skin. It will work as a barrier only. So it will reduce the further evaporation or losses from that skin, but it will never ever give the hydration. So if we want hydration along with maintaining as a barrier effect, we should use oil with moisturizer as a double effect.
Other Dr. Bali, do you think there are specific areas
Like,
of
yeah,
no, please continue, Dr. Bali.
yeah, yeah. So certain oils which is really helpful because that oil actually not cause further dryness. That is coconut oil, which is number one best oil to use during the winter. And other oil like almond oil and sesame oil that we can even though use, but study shown that definitely it will reduce the chances of dehydration of growing skin. Coconut oil massage in preterm baby.
All right. And Dr. Bali, are there specific areas of a baby's body that need extra protection during winter?
Yeah, so the know that the most common exposed area may having a faster enhance the dryness. So the area is like cheeks, lips, exposed extremities, flexible points such as ankle and knee. Because of higher exposure to may cause dryness as well as water losses. So skin disintegrity. So that is the actually point where should we give more attention and care.
Okay, and how can parents protect those specific areas that dry out faster, like cheeks, lips, elbows, knees? Is there any specific instruction you have for those specific areas?
Yeah, so like apart from lips, you can apply moisturizer all over the body. Why not I'm saying on lips? Because the test may cause baby and such baby may having a confusion with the breast milk. So in that scenario, usually we ask to mother to put the milk their own milk on the baby's lips always apart from lips, every part of the body you can apply moisturizer at least 3-4 times a day. As well as in the bath, you should apply moisturizer and within 4 to 5 hours, again you can re
Okay. I'm going to take another parent question, Dr. Balde. This is from Farhana. And Farhana asks, my baby scratches her face due to itching. Maybe. Will mittens help prevent skin damage?
Yeah. So there are two things. If your baby is just like a neonate within 30 days and the baby is sharp, so actually they are not doing itching. They're having a tendency face and body. So to prevent that, definitely you should use. If your baby is more than 2 months and 3 months, and the baby is having habit to specifically face around the lips, then basically two reasons. As soon as the baby is saliva may cause dryness as well as irritation on the face and cheeks. Apply moisturizer or emollients on the face itself, because that will work as a barrier. So rubbing definitely reduce.
You spoke about the age of a baby, Dr. Balde, and I have a follow up question to that. Do newborns need a different winter skincare routine as compared to older infants?
Yes. So newborn, as I told you, the capital is not developed as it develop within a few weeks to few months. So as such, we can't trust on any product to apply on baby's skin. So first we have to be give only outside the environment first. Second, if it's the winter surrounding, we must use clothing first. And second thing, we should use the trust bleach, and definitely we should go with that the same pH 5.5, because within a few weeks we turn up from alkaline to that as mild acidic pH. So we can apply moisturizer even though in the neonates. There are not any restriction. But yes, as soon as the baby is
Dr. Balde, what if the baby already has sensitive skin? How do you adjust the winter skincare routine then in that case?
babies with sensitive skin, winter cold and low humidity can trigger or worsen eczema like rashes. Any new redness, oozing, or persistent itch warrants careful evaluation by the pediatrician. As I told earlier, if it is itchy and causing pain to the baby, definitely we should take a medical attention. Or as we can apply moisturizer and emollients and observe for first 2 or 3 days. If it is improving and the baby is for the same thing.
Right. And is it safe, do you think, Dr. Balde, to take babies outdoors in cold weather conditions? And how can their skin be protected?
So a winter care routine usually includes shorter, less frequent bath, as I told earlier, cream, ointments, and additional protection of exposed area with clothing and barrier creams when outside. When the baby is taken outdoor in cold weather, protection includes mittens, socks, and apply a bland, occlusive, or rich cream on exposed skin to reduce transepidermal water losses, which may cause skin damage as well as
Right. And to that point, of course, babies going out and the clothes that they wear, it's winter season. We have a question from Kusum who asks, do woolen clothes make dryness or rashes worse in babies?
So, yeah, there are two, three studies which were showing woolen cloth is when we are using naphthalene ball and when we are using a harsh detergent, those woolen cloth is that may actually worsen the skin rashes. So we use woolen clothes, but not directly. We should use first inner and then we should use woolen clothes. So the inner should be like cotton based, and over the inner we should use woolen cloth. No, but not directly in the contact with the skin. If we are using any emollients inside that inner wear, definitely it will give enough from the woolen clothes also.
Right. And can winter dryness, of course, there's because of the weather, the winter dryness, can it lead to sleep disturbances as well, you think?
So, although if the baby is having an itchy skin, definitely it may cause irritation to the growing kid. And irritation is not time bound. Anytime. It may be in the midnight, it may be early in the morning. So definitely such type of irritation may disturb their sleep patterns.
I'm going to take another viewer question here, Dr. Balde. Um, Nitya asks, I'm in my eighth month of pregnancy. Should I buy skincare products in advance or wait till my baby is born?
Please, can you repeat the question again?
Yes, of course. Uh, Nitya asks, I'm in my eighth month of pregnancy. Should I buy skincare products in advance
Okay.
or wait till my baby is born?
So definitely you should wait first for few days. Why? It's a 8 month of pregnancy, so at least you must have 4 to 6 months till the time the winter gradually on the peak usually reduce after Jan. In the first week of Feb, gradually reduce. At that time, you have to be apply mild moisturizer, not intense moisturizer. You have to wait till the baby's delivery, and after that you can. And after 15 days, it should apply.
Thank you, Dr. Balde. We're going to take one last viewer question since we seem to be short on time. This is uh, this is from Aruna, and Aruna asks, "Is it okay if I skip a bath for a day or two in winter?"
Of course, why not? As I told you, you can give 2 or 3 times a bath total in a week during the winter. So definitely you can manage either alternate day bath or once in a 2 week. So yeah, first thing. Second thing, if you really want to skip, you can do only sponging to your baby during the winter season.
Thank you so much, Dr. Balde. Thank you so much for sharing such clear and practical guidance with all of us today. Would you like to share some concluding thoughts?
So there are 2, 3 things actually which I want to discuss with this social platform. For in my day-to-day practice, me, should we apply mustard oil? Should we apply haldi to my baby? Should we apply besan or like loi, atta loi? So this type of product, actually mustard we know that contain lots of pesticides and during the processing, so that may harm the growing skin. First thing. Second thing is besan loy in a growing baby, that may harm the growing superficial skin layer of the baby. In last 30 minutes, that's called stratum corneum, and that may disturb even though acid mental so better to avoid this type of any product. Even though if it's good, we should avoid. No requirement of any type of
Thank you, Dr. Balde. Of course, winter months can be challenging
and
for
and
babies.
and yeah, yeah, and let me finish with the one sentence. If you are using to care of your baby's growing skin and moisturizer, better to go with the in the last 30 minutes 5.5, and with the gentle ingredients, not with not follow the decorative looks. Yeah.
Absolutely. Thank you for all the practical information, Dr. Balde. To all the parents who joined us today, thank you for your time and for engaging so actively in this session. We hope today's workshop was helpful. It helped you understand why dryness happens and what simple steps can make a real difference in your baby's everyday comfort. If your child's dryness persists, becomes red or itchy, or you feel uncertain at any point, please consult your pediatrician or pediatric dermatologist. Early attention helps prevent complications and keeps your baby happy throughout the season. We appreciate your participation and we look forward to having you in our upcoming sessions. Have a wonderful evening, everyone, and take care of yourself and your little one. Dr. Balde, of course, thank you so much for being on this platform and for sharing your views.
Thank you, Carolina, for the
With everyone
wonderful
here.
learning. Yeah.
Thank you so much. Thank you so much, everyone, for being here.